PCOS is basically what we define as polycystic ovarian syndrome, in which you can have many symptoms such as hair around your face, excessive hair around your face, irregular periods, acne. All these are symptoms of polycystic ovaries. Polycystic ovaries basically is that ovaries have more than one follicle growing in a cycle. Normally you have only a single follicle growing in a cycle, but in polycystic ovaries you have many follicles growing together. But unfortunately they don't grow to a size in which they can ovulate. So that's why you get something called as anovulation, and that causes irregular periods. So if you ask me whether a person with polycystic ovaries can have normal period, the answer to it is yes. When that happens is because you may not be anovulating, you may be ovulating even with polycystic ovaries. You may have other symptoms such as hirsutism and acne, but not anovulation. So yes, you can have a normal period if you are having polycystic ovaries. Basically a pad, this depends on a person to person. It depends on the flow of your period. If your period is heavy, you may even have to change 2 or 3 pads in a span of 6 to 8 hours. And in the normal flow, you may even change between 4 to 5 hours. So there's no consistent answer to this. Depends on your flow. But for hygienic purposes, you should definitely change your pad every 4 to 5 hours. Okay, so first I'll explain to you what is a regular period. Basically, if you get periods between 21 to 35 days every month, that is a regular period. So if you get your cycle is 24 days, 28 days, 33 days is also regular. If you get period less than 21 days or more than 35 days, then I can call it as an irregular period. Secondly, if you get period for more than 7 days, suppose you get for 9-10 days, that is irregular. Or if you don't get period for a long span of 90 days, that is irregular. If you have irregular periods, definitely go and see your gynecologist. Don't try home remedies, don't do things which you don't know. Any food, any items which you think will get period doesn't help. This is not normal. There is something which is called as primary amenorrhea. Basically, a girl should get a period from the age of 9 to 15, which is a normal time that a person gets a period. 17 years doesn't seem normal. If you don't get your period by age of 17, you definitely have to go and see a doctor. Secondly, before you get your period, you have some secondary sexual characters which develop, such as development of breast, hair around your axilla, below your armpits. Such things, if they haven't developed and still you haven't got your period, please go and see your doctor. Yes, excessive of anything is not good, but you can definitely do light exercises, lower abdomen exercises, power yoga. Such things do help. They actually help in releasing endorphins, and these endorphins can help you in reducing cramps. Okay, so basically, since everything is all because of periods coming to girls, there is something which is developed which is called as a man period. Man period basically is the PMS syndromes which girls face. The similar syndromes are faced by men because of hormonal fluctuations, testosterone levels going up and down, which can cause depression, fatigue, anger, such symptoms coming to men, mood swings. But this is not a hormonal cycle like females. They do not get a period, they do not have ovulation. So this only and only depends on the hormones, and basically they only have mood swings. It may not be there, but yes, definitely there could be a man period. Okay, if you miss your period, first and foremost, if you're sexually active, get a pregnancy test done. That is the first thing which comes to anyone's mind. You may be pregnant. Secondly, if you miss your period, there could be hormonal changes, there could be not getting period because of several causes. There could be many hormonal changes such as thyroiditis, or there could be polycystic ovary disease. You have to go and meet your doctor. So they will get your test done and maybe then see what is the reason for you to not get your period. Menstrual hygiene is very important. You first decide what are you using. Are you using a sanitary pad, a disposable sanitary pad, you're using a tampon, you're using a menstrual cup, you're using a sanitary pad which can be reused. All of them have to have separate hygienic methods to use. If you're using a sanitary pad, definitely change your pad every 3 to 4 hours, maximum 5 hours. If you're using a menstrual cup, it has to be clean, boiled, used. The hygienic methods of that have to be maintained. Tampon has to be changed 4 to 5 hours. Can go on to 8 hours, but if you're having a heavy flow, definitely you should change your tampon. If you're using a reusable cloth, that has to be washed, that has to be sanitized and used. You must use a fresh towels when you're having a period. You should have clean undergarments. Try and keep that area as clean as you can, and take bath daily. You should avoid fast food every day. Anyways, fast food contains preservatives, canned food. All these items are not good during periods or any other time. Basically, fast food should be avoided if you're having irregular periods and if you're having polycystic ovarian disease or syndrome. Fast foods and such items are only leading to obesity. So if you are having polycystic ovaries and if you are having irregular periods, you must avoid fast foods. As I explained to you, PCOS is polycystic ovarian syndrome. This is first of all not a disease. It is a genetic thing which you get it through your genes. In this, there are many follicles and you may not ovulate. So for any young girl suffering from polycystic ovaries, I would first like to tell you that you should have a very healthy lifestyle. 30 minutes of exercise daily. That is the key to polycystic ovaries. Secondly, you should avoid fast food, preservatives, and try and reduce your weight. Basically, obesity it's a vicious cycle. Obesity leads to polycystic ovaries leads to obesity. So if you want to break this cycle, you have to first lose weight. 10% of your body weight if you lose, and if you do regular exercise, even if you have polycystic ovaries, you can overcome the symptoms of this disorder. There are many other treatments which we can offer, like medication, but this is something that you can do yourself. So you can do these things and you can get over and not get the symptoms of polycystic ovaries. Something that is very recent and very unknown to our young generation is something called as HPV vaccine. This is a vaccine which prevents human papilloma virus. It is a HPV cancer prevention vaccine. It is marketed as Gardasil as well as Cervarix. These are two vaccines available in India. These vaccines have to be given in the dose of 3 doses once in a lifetime. So they can be taken one in 1 month, one in 2 months and one in 6 months. This is a cancer prevention vaccine which should be given to each and every young girl. Earlier it used to be only up to the age of 9 to 26, but now it is even from 26 to 45 years of age, even if you are sexually exposed. This vaccine is basically to prevent the virus which is transmitted through sexually transmitted disease, and something that should be given nationwide.